Welcome to WellVet, your local small animal veterinary practice. I'm Sally and I'm going to talk about how we care for your companion animals in our clinic and how you can help your animals at home in an emergency first aid situation before you are able to get them to the veterinary clinic. According to the Pets Dispensary for Sick Animals, the PDSA, dogs, cats and rabbits accounted for 52% of companion animals in 2021. Equating to 9.6 million dogs, 10.7 million cats and 900,000 rabbits, making them the top 3 choices for animal companions. But I'm wondering as to how many people at home are familiar with animal first aid. I'm here to advise you how to deal with a first aid emergency and how to look after your animals on admission to the veterinary clinic. At WellVets, we are members of the RCVS, the Royal College of Veterinary Surgeons, using their practice standards scheme, which is an accredited framework that ensures we have high standards of care for our animal patients and their owners. All our professional staff are registered with the RCVS, and we are committed to providing you and your pets with the best care possible. Legally, the Animal Welfare Act 2006 makes everyone owning a vertebrate animal being responsible for them, including the prevention of unnecessary pain and suffering. Okay, before we talk about first aid, let's think about what equipment you could use at home in an emergency or for minor injuries, but please remember to consult the veterinary clinic if your animal needs any type of treatment so that we can make sure that everything is okay. With regards to first aid treatment, the Veterinary Surgeons Act 1966 includes an amendment called Schedule 3, which means anyone can perform first aid on an animal to save its life or prevent suffering. But please remember it is important to contact us immediately, don't delay, in any animal emergency for expert help. A basic first aid kit for animals at home could include many products, but please make sure that everything is sterile before you use it to prevent secondary infections. Disposable gloves can be used to prevent cross-contamination to the animal and yourself, and also protect you from any risk of zoonotic diseases, which are diseases spread from animals to humans, such as rabies. A suitable pet-friendly antiseptic could be used, such as chlorhexidine, for cleaning minor scrapes or wounds. This one does need dilution before use, so please check the instructions. There are others available that can be used on animals. A tick remover. Ticks are small parasitic spider-like blood-feeding mites which can burrow under your animal's skin. These can be tricky to use as you need to ensure the whole of the tick is removed, as they can infect your animal and they are also a source of Lyme disease, which is zoonotic. Ticks can easily be removed by veterinary nurses if necessary. Tweezers can be used to remove bee stings or thorns. Again, if you're not sure, please bring your animal in to us for treatment. You can use dressings and bandages, but of course sticking plasters are not suitable as they will stick to hair or fur and will be painful for the animal when you remove them. At the veterinary surgery, we use 3 layers of bandaging which you could have in your kit. After the wound is covered in a suitable dressing like this one, we do not use cotton wool as that will shed fibres and contaminate the wound. The first layer we use is a padding like this one, which cushions and supports the wound. We then add a second layer. This one is a conforming bandage, which means it will stretch around the padding so that you can wrap it around. The last layer is the cohesive layer, which holds the bandaging in place by being adhesive and sticking to itself. I will give you a quick demonstration just to show you what I mean. A quick demonstration of how we would do bandaging in the vets. This will be for a minor wound on a paw, okay? So of course I have my gloves on, so everything is sterile that I've used here. First thing I'm going to do is to cover the wound. The wound has been cleaned, so we cover the wound like that, just on the paw, okay? And then we're going to put some padding on the wound, just to give it some support, and also so the animal can walk on it if necessary. So when we do bandaging, we usually start over the wound and upwards, and we're going to go back on ourselves like that, and then back round again. And we're going to go above and below the wound, and we're going to go around the joint. And we're going to overlap ourselves each time. If you need to do this at home as you're bringing your animal into the vet, just do the best you can. If you don't have any bandages, then a clean towel or anything like that will do until you can get the animal into us. Okay. So we're going to go above the joint so this keeps the padding on, and it just makes it a little bit more comfortable. The next layer we're going to put on is the conforming bandage. Again, I'm going to follow the same line as I did before with the padding. So we're going to go back on ourselves, and then we're going to go around. Be careful not to do the bandaging too tight because you may cut off the circulation. Normally, if we're putting dressings on a paw, we will put some padding in between the toes. This stops the foot from sweating, and it's a little bit more comfortable. Just make sure you cover every area. Like so. And the last layer is the cohesive layer. So again, we're going to follow the same method as we did before. We're going to go over and back and round. In a real life situation, of course, the dog may not sit like this for you. So you may need to have some assistance. A little more tricky doing it on a soft toy. Obviously it's not anatomically correct like a dog. Just remember not to stretch this dressing because it will stretch back on itself and it will be too tight, which may cut off the circulation. Okay, and you can either pull this or just cut it. When you finish, just make sure that it won't pull off, and if you can fit 2 fingers underneath, then it's not too tight. But this is just for an emergency at home. You don't have to do this. As I say, just wrap it in whatever you can and get your animal to the vets. Thank you. Okay, so as I said, this does require some practice and skill to do bandaging. I will talk more about this in more detail in my next video on bone fractures, and you can see how it's done in the surgery. You can also have blunt-ended scissors for cutting dressings. These are safer than using ordinary scissors, as if your animal is moving around there may be a further injury to the animal or even to yourself. A foil blanket is handy to keep the animal warm, as well as a thick towel or a blanket. You could also have a large blanket that could be used for large dogs, or even use it as a stretcher or as a form of restraint if necessary. You may need to restrain your animal and you can use items such as spur lead or a harness, or use a pet carrier. There's a risk of being bitten by an injured animal, which may be frightened, so a pair of gauntlets may come in handy. If you drive, it will be handy to have first aid equipment in the car as well as at home, in case you need it for your animal companion, or even if you come across injured wildlife or a dog or a cat that has been injured on your travels and you want to help. A first aid guide is a good idea to put in your kit for more instructions. If you do not have one, we have them at the clinic, or you can get one from organisations such as the Blue Cross or the PDSA. They are available online as well. The next videos I have for you include 3 different types of animals' first aid emergencies, what you can do at home and what happens when the animal is admitted to the clinic. I will explain what we do and why, what happens before, during and after any treatment or surgery, the types of equipment we use, and once your animal is back home with you, how you can continue to aid their recovery. Please click on the links in our YouTube channel for more information. Thank you for watching.